Welcome, everyone. My name is Vilmarie Joubert, and I am a wellness coordinator for Tempo Bestmed. The month of October is declared as Mental Health Awareness Month with the objective of not only educating the public on mental health, but also to reduce the stigma and the discrimination that people with mental illness often are subjected to. We want to ask all our participants to please use the chat box to ask any questions, and I will relay them to our speaker to answer. And if you have any questions for Bestmed or for Tempo, please email us at tempo@bestmed.co.za. So today we have Sister Tabisile Makaye with us to speak to us about mental health. She is a healthcare manager, managing diverse healthcare related projects, large groups, including clinical and non clinical teams. She has a diploma in clinical nursing sciences and community nursing. She is currently working as a Health Impact as a national operations manager. Her areas of expertise is employee health and wellness, clinical program implementation, mental health programs, and managing risk and legal compliance. Welcome, Sister Tabisile. We really are looking forward to hearing what you have to say to us today.
Thank you, Vilmarie, and thank you for a nice introduction. Welcome to all the colleagues online. I am very privileged to have this opportunity to share mental health care, self-care, and the tools to deal with mental health issues. As Vilmarie has introduced me and also highlighted the request that please, if there are any questions, we are free to flight them on the line, and then she will relay those to me. And also, if we have the opportunity, we will allow the members to engage directly with us. Thank you so much. I guess we're starting now. Vilmarie, am I okay? Am I right? Good. Thanks, colleagues. As you can see, the globe that is showing here, it's an interesting globe from this first slide. It's highlighting mental health, and it's got various items that are listed, like the fitness and exercises, the diet, the leisure, the healthy living, the care. This is all encompassed in us trying to make sure that we are looking after our mental health. But for the purpose of this presentation, I've got the outline, and I'm going to share the outline with you, colleagues. And on the outline, we're defining the mental health well-being. I hope it's showing on that side. Vilmarie, is it showing? The next slide. Yes. Okay, perfect. We will define the mental health well-being. We will review statistics of mental health, especially in the workplace. We will also provide tools to support someone with a mental health issue. We will look at balancing the 7 dimensions of mental wellness, and we will define briefly mental ill health and the related symptoms. And we've also just put a brief summary on how depression manifests in the workplace, because we're talking especially within the workplace, but we're not going to limit that, because we fully understand that from work, we're coming from our community. We have families, we have relatives, we have friends. So we will apply that wherever we need to apply it, so that we ensure support for the individuals that are going through challenges relating to mental health. Then lastly, we will look at the efficient and robust solutions, especially in the workplace, which can also be tailor-made to fit our family lives. Just to start off, to kickstart the presentation, mental health presentations have a tendency to invoke certain feelings within us, where we look back to our past, or it will touch on the current, and makes you somehow uncomfortable. So I just would like to encourage the participants, the colleagues, that if that happens, please tap into your inner self. You can do your silent breathing exercises while we are going through, just to make sure that you calm down, because the idea is to equip us, not to invoke certain feelings, but somehow that will happen automatically, where you find yourself going back to certain challenges or situations that you have come from. The slide that I'm currently flighting is by Dr. Lauren Fogel-Messi. She says your present circumstances do not determine where you go. They merely determine where you start. So what I'm trying to say here, and to encourage all of us, we may be sitting with problems or challenges or experiencing certain mental health issues, but that does not determine where we are going. That should merely say to us, okay, this is where I start now. How do I start? How do I move forward? And then take it from there. Obviously, it's very important that when we do that, we tap into all the resources that we've got, internal resources, our support structures, our families, EAP services that are available at work, and also within the community health centers if we are not part of a particular medical aid. But most of the medical aids do have cover to make sure that we are supported in our times of need. But again, I'm just saying our present circumstances do not determine where we are going. Rather, it's merely the start of the future. And that's the mentality that we should always try and adopt. Okay, now we're looking at understanding the mental health and well-being itself. Well-being, or having a good mental health, is not necessarily the absence of any particular disease or illness. A person might be diagnosed with a mental illness, but be healthy at that particular time. We within the health sector will talk about a continuum of health, which is kind of like a linear scale, where we look at 100%, where you are 100% well, and midway you find that you are not doing too well, and on the right side of the scale you are sitting at a 0. So at any given time we move around this linear scale, which determines whether we are okay or we are not okay. So what we're saying here, it really does not mean that there is an absence of a disease or an illness, but it's rather a complex a combination of complex factors that we go through, or that are governing our health status, like our physical abilities, our mental, our emotional and social factors. And all those combined then give us our mental health, well-being, or a mental illness. In short, what we are saying about this is that when we look at mental health, it's about how we feel about ourselves and our life at any given time. It means that we have the ability to cope and bounce back from stressors of life or sadness that has come upon us. It is strongly linked to the happiness or life satisfaction within any space that we find ourselves in. So it's quite important that we are aware of these factors, so that we are able to bounce back if there is a need. Obviously, I'll keep stressing that it's important that we raise our hands and we call for help, because sometimes we sit with problems or challenges that could have been dealt with at an earlier stage, and then we end up with complications. There are three components of mental health and well-being. When we look at this component, we look at the cognitive part of our health. That is our thoughts. Our thoughts are very important because they influence how we feel and how we act. There is a number of thoughts that are going on in our lives within a given space of time. It's like a radio is playing behind the scenes. So it's very important for us to be able to choose which kind of thoughts are we going to entertain. Because if we allow all the negative thoughts to sit within us, psychologically they say we need to intercept those thoughts within 6 seconds and replace them with positive thoughts. Otherwise they become a reality, because we keep thinking about them and then they will influence how we feel. The next thing, you feel sad. The next thing, you act based on that. And yet it could have not sometimes it's just a hypothetical thought. It's not a reality that you feel. You need to test our thoughts to make sure that when it affects us, it's a real thing. Then emotional health. Emotions help us and motivate us to act accordingly in line with our goals and with our values. When we give our emotions more credit than they are worth, we are running a risk of getting caught up in the riptide, where now we are entertaining these emotions. Sometimes they are also not real, like our thoughts. Most of the time, you find that you feel what you are feeling, and it's not real. But if you step back and look at it, and we're like, okay, no, it's not like that, and you will find that it's not that bad. But how we look at it is most of the time, especially if it's something personal, we tend to exaggerate. Like, for example, we might make a mistake at work, and then the manager comes across and correct that mistake. It's a genuine mistake, but it doesn't mean that we must beat ourselves up because we made that mistake. We make mistake all the time, and we learn for this. So we need to take charge of our emotions and make sure that we are empowered and we can engage healthily with the world that is around us instead of avoiding these emotions, because sometimes there is a flip to the coin. Most of the time we entertain them, and sometimes we ignore the emotions. So if there is no balance, it means that we are not in touch with your situation, and we cannot be able to deal effectively with it. And lastly, it's our behavioral health. This is how we engage with the world that is around us, how we are functioning, and it determines also the quality of our relationships and with the people that we live with, and it gives us a sense of belonging. So the three components working together in coordination will give us a balance in our health and well-being. And then I'm looking at the statistics now based on the SADC, which is the South African Depression and Anxiety group. The statistics that they came up was, for example, if you look on the extreme left, you see that 2 in 3 people will disclose their mental health condition to the co-worker, and 61% will disclose to a manager or supervisor. But having said that, you find that also, where I looked at the EAPA report, which estimated that only 15 to 25% will actually seek help. So it's important that we improve that 15 to 25% so that everybody can receive their help. And it all relies on all of us as a community, or as community at work and also at home. We assist one another so that we are able to guide our friends, our colleagues to seek help and destigmatize the issue of mental health, because that is the main problem. That I wouldn't like to be known that I'm not feeling well, I'm taking medication, or I'm seeing a psychologist, or I'm seeing a psychiatrist. And then the other portion tells us that most of the people have taken time off work in the last 12 months, and the percentage that we are giving there is 56%, and 44% have been at work with their mental conditions. And this is why we get the terminology that says there is presentism. You are there, but you are absent at work. And because sometimes we are scared to report that I'm not feeling well, or you feel that there is a lot of work that needs to be done, and you find that while you are at work and not feeling well, you are not performing at your optimal level, which also then leads you to have mistakes. Once we make mistakes, then it's complicated, because people are going to highlight on the mistakes, and then they make you feel even worse that you are not good at what you are doing, and further exacerbating your condition. Then when you look at the 79% females, this one was reporting on between the genders. It shows that 79% are females that are suffering from mental health reported at work, and 21% was males. Firstly, we know that as females, we make up a greater percentage wherever we are, but also it's the fact that females are more open to take care of the conditions that they are feeling at any given time. And you find that males have a tendency of not seeking help early. And that's why all the programs that are run within employee wellness and EAP are now gearing towards improving the male uptake so that our colleagues can also come up and seek help. And then the last part of the statistics speaks to the relationships. The mental illnesses affecting key areas of our lives. For example, 74% people reported that their relationships were affected, and then 72% it was work performance, and then capabilities. General capabilities was 49%, leave days that were taken was 42%, and then the promotions that were affected, people were feeling that they were not promoted because of the mental illnesses. So you can see how it then generally affects the individual within the workspace. And just one more other component within the statistics was that in South Africa, it's also reported, according to the EAPA report, the January report 2023, that depression or absenteeism due to depression cost the South African economy close to 19 billion rands. So it's a really difficult topic that we need to look into for the well-being of the employees, for ourselves, and also for the economy at large. Then this slide talks to the causes and risk factors of mental health. The environmental exposures before birth, a history of mental illness at home, stressful life situations, ongoing chronic medical conditions. You find that people have ongoing sicknesses that are not improving. That will definitely lead to somebody not feeling or coping well mentally. The use of recreational substances, bereavement or losing someone close to you. This is one of the causes that will tip somebody that has been well and functioning properly, but all of a sudden, because of a loss of a close or a relative, then they go into a form of mental illness. Traumatic experiences like assaults, the hijackings, brain damage due to a serious injury, maybe it's a car accident, and then you end up with a head injury or something to that effect. Childhood history or abuse or neglect, few friends or healthy relationships where somebody is quite lonely and is alone most of the time, a previous diagnosis of mental illness, and then again, a piece of stats will indicate that about 1 in 5 adults has a mental illness in any given time. Remember, once again, when you say mental illness, we're not saying that the person is admitted in hospital, but within that linear scale that of health, of mental health that I explained earlier on, you are kind of affected, and you to an extent that you might need treatment, still be at work, still be at home, but at the end of the day, there is something that is not right or not well balanced mentally that requires attention. That's why we say 1 in 5 adults would experience some form of mental health in any given time. Then we're defining mental ill health and the symptoms. I think I've touched on this briefly, but mental illness refers to a wide range of mental health conditions and disorders affecting our mood, our thinking, and our behavior. The symptoms that you will see often is the person will feel sad or they feel down. There is confusion or confused thinking or reduced ability to concentrate. There is excessive fears or worries for extreme feelings of guilt. There is extreme mood changes or mood swings. One time she's okay, the other time she's very low, or he's okay and he's low. There is withdrawal from friends and activities, and significant tiredness or low energy or problems of sleeping. Either they sleep too much or they sleep very little. There is insomnia. And again, you see that there is detachment from reality. This is one of the symptoms that you'll see in cases that have progressed quite significantly, where there is really mental illness condition that has been diagnosed with the patient has been diagnosed with. You find that the person is totally detached from reality. There is delusions, there is paranoia, there is hallucinations, where the person will be telling you that they are hearing voices or somebody is out to kill them or something to that effect. And there is inability to cope with daily activities, and or there is stress problems that the person cannot cope with normal stress. Every day we go through normal stresses of life. Like you are preparing a presentation, now you like worried, oh, is it going to go well? Is it not going to go well? What is my manager going to think about? That is a normal stress that keeps you going and encourage you to do things well. But if all of a sudden now you find that the person cannot cope even with minor stuff, then there's a problem. Also, there's trouble understanding and relating to situations and people. There's problems with substance abuse. There's major changes in eating habits. Either they eat a lot or they don't eat at all. And there's problems also with sex drives. There's changes with their sex drive. There's excessive anger, hostility, and violence, and also suicidal thinking, which is one of the common mental ill health conditions that we have seen in our country, that most of the people have suicidal thoughts. And if this happens, it's very important for us to take those seriously, because there is a couple of myths around suicide where people think if she talks about it, she's not going to do it. And yet once the person speaks into suicide, it means she's been thinking about it for a long time, or he has been thinking about it. And we have to act very quickly and decisively to make sure that that person gets to be seen by the healthcare providers and be assisted. And then there's persistent or unexplained aches and pains, because psychologically we always say the brain cannot feel, but everything that is stressing us will be manifested in our bodily symptoms. That's why you'll find that people will have unexplained aches and pains. And then the next slide, which I think it's important for us to note, is how depression manifests in the workplace. We just chose one topic, which is also very common, depression, because this will help us to understand our colleagues and assist them, because what we see is they feel differently. For example, what depression feels like, it's deep feelings of sadness. And on our side as colleagues, we see withdrawal from the team and the person is isolating themselves. While they feel loss of interest in work or social activities, we see them as indifferent. Difficulty concentrating or slow thoughts, we see them as putting things off. They're missing deadlines, or they are prone to accidents. There is forgetfulness, which is shown by they seem that they are scattered or they are absent-minded. They are not with us. There is trouble making decisions. This is part of what they feel. But we look at what we see as colleagues. There is procrastination. There is indecisiveness. There is slowed productivity. On the other side, there is trouble sleeping, or they is sleeping too much. Then what we see at work, this person is always late to work. There is afternoon fatigue. In the afternoon, she can't seem to be doing anything, you see, or else also they are prone to accidents. There is feeling of worthlessness or inappropriate guilt. We look at them and we say, okay, they're unsure of their abilities. They lack confidence. Something is causing that, which is that feeling of worthlessness that they feel. And again, there's energy loss or increased fatigue. We look at them and think, oh, they are not motivated. There is low motivation. They are detached from us. Again, there's also irritability. There is anger or tearfulness. We look at them and we're like, oh, there is inappropriate reactions. A slight thing. Tabisile is crying. She shouldn't have cried. She should have, because we don't know what's going on with them. And also there is strained relationships. And lastly, most of the time you find that there are weight changes. It's either because remember earlier on I mentioned that there's changes regarding the eating patterns. If the person experiences weight loss or weight gain because of the appetite changes, then we look at them. Oh, there's change in appearance. What's going on with her? She suddenly lost such a lot of weight, or she's gained so much weight. So those are the comparisons where we should think more when we see anything that is changing with our colleagues, even with ourselves or with our families. Then we are able to tap and say, okay, something is definitely not right. And then we will move to the tools to support someone with mental health. Just here we are saying we don't need to be therapists to assist, but we can support someone by just being there and listening to the particular person. Withholding judgment, it's very important, because most of the time you will find that the friend will tell you, hey, I'm going through this because of 1, 2, 3. And you're like, no, but you caused that to yourself. Why did you do this and that and that? It's easy for us to find fault. But what is important with mental health is that we avail ourselves and we do not judge, but we just sit there with the person and connect with the person and allow them to voice their feelings in a non-judgmental manner. Then we assist them to connect with appropriate resources. But also very important, when we are in doubt, we just offer that support by listening, giving them a listening ear, and then leave the advisors to the experts, because the experts will then be able to channel the people appropriately. Sitting where I am as a nurse, I also know that there are areas that I cannot assist the clients with. I am capable to identify challenges, problems, but sometimes I know, okay, this you refer to this, the psychologist, you refer to the psychiatrist, you refer to whoever that the client feels will be able to assist them, even starting off with their own doctors, because those are the people that we trust. So we tap into the resources and just guide them, because sometimes the person knows exactly where the solution is, but they just need guidance and reassurance to say, yes, what you are thinking about is the correct way of going about this particular challenge that you are facing. And then we've mentioned a few tools to support someone with mental health challenges. Also, very important, there's stuff that we must say and stuff that you should not say. For example, we don't say that there's always someone worse off than you. You should be grateful for what you have. Instead of, it's a normal way of saying, but it doesn't help when it comes to a person that is already going through challenges. So try not to say these things. There's always someone worse off than you. No one ever said life was fair. It's a common saying, but it doesn't help anyway. Stop feeling sorry for yourself. You need to snap out of it. It's a common thing. I remember we were running a substance abuse program a few months back, and we adopted this thing of saying snap out of it. And we said, okay, just choose. Anybody must just choose something that they're addicted to, like your Facebook, and try not to go into Facebook for a day and see what is going to happen, how difficult it is to snap out of something like substance abuse. And then people started feeling that it's easier said than done, because you always say to this person, just stop drinking. I'm just using an example of substance abuse. Stop drinking, or drop this boyfriend, drop this girlfriend. It's not as easy as that. So these are the things that we are not supposed to say. Oh, have you tried just being happy and just forget about this sadness of just try it. I know how you feel. We like to say that. We definitely do not know how the person feels. They just don't know. They don't know. We don't know how they feel, definitely. So rather, let's say, I am here for you. You listen to that particular person. I'm here for you. You are important to me. Let me know if you need to talk. Okay, come talk to me anytime. It sounds better. It's you saying, I am here for you. I'm available for you. I am here. I'm not judging you, but I'm here for you. I definitely do not understand how you feel, because that's the correct thing. You don't know how this particular feel. We think we know, but we do not know. So rather we don't say that. Just stick to say, I'm here, I'm available. And what is important, be available for that person, because if we promise and then we don't keep the promises, we are reinforcing those feelings of not being worth of anything, and that creates a problem. Right, and then providing ongoing support, we keep listening to them. We let people improve at their own speed. We don't push. We let them improve at their own speed, because every individual is unique. We are unique. Our situations are unique, just as us. So it's important that we allow Thabisile to be Thabisile and Vilmarie to be Vilmarie, because we are different and our backgrounds are different, and the situations that we're going through are definitely unique to us. So we set aside our own expectations and the judgment. We are there, we are present, which I've mentioned, and ask what we can do to help them. We always convey hope. And most importantly, we educate ourselves about mental health issues, so that if we listening to these people, we got an understanding of somehow what is happening, and most importantly, of the resources that are available for us within the company, within our community environments, as a family. Where do we go to when we are hit with these issues? And then the next slide will talk to 7 dimensions of mental health. One being the physical, mental wellness, sorry. One being the physical dimension, which consists of everything that helps our physical bodies to function well, such as our routine exercises, staying hydrated. You know, it's important to drink water. Water is healthy. We need to drink and be hydrated, because once we are not hydrated, your brain is not functioning well. You eating a healthy diet, and we also getting enough sleep. Emotionally, we look at our emotional health by maintaining a positive attitude as much as possible and managing our stress. We can say we're maintaining it, we're trying our best, but when we feel that we're not coping, it's important to be in check with your emotions, and also check, like we said earlier on, the thoughts, the emotions. Sometimes they mislead us, so you need to check and manage your emotions. Talking about how you feel is important, rather than bottling it up and not saying anything, and then you show up with anger and stuff like that. Sometimes we don't really say what we feel. It's important. I feel like this. When you do this, I feel this. We avoid saying you are doing this to me. No, it's me that is feeling this way when this happened. And that helps to begin with the conversations. And then spiritual dimensions. This is one's search for a meaning and a purpose in our human existence. We can nurture this dimension through meditations, walking in nature, where we say we are connecting with nature. That's why there is this say that you must just stop and smell the roses and stuff like that. Just connect with the nature, and do your walks wherever it's possible. And breathing exercises are very good. You take time even behind the desk and just do those breathing exercises to make sure that you release, you inhale, you release the stress. And practicing our faith, most people will tap into this most of the time. It's part of the 7 dimensions, where you're getting in touch with the higher powers, whoever that may be. And the other one is our occupational and career dimensions. This is where the individual recognize their personal satisfaction and enrichment in lives through our work and ability to gain personal fulfillment from the jobs and chosen career fields, while we are still maintaining a balance in life. This is where we will be like, we feel good, I've achieved a target A and I'm achieving target B. But the most important thing is that we need to maintain our balance. And we spend most of the time, 8 hours at work, And this is where sometimes there is misbalance, because people are more concentrating on the occupational or career dimensions and ignoring the other ones. Intellectual dimension speaks to our mental activities and our creativities, where the person will expand their knowledge and skill while discovering their potential, and also the ability to share their gifts with others. Environmental dimensions, we know the buzzword is about environmental health, preserving our environment for the future. This is where we look at protecting the earth that we have by protecting the resources. And this is really a way of life that places value on the environment that we live in, that we work in, and that we play in. And I've just given an example of recycling. Some people find a way of keeping themselves busy, like they will be engaged in the recycling activities within the communities, just to balance your acts. Social dimension is the ability to relate and connect with other people in a healthy and a balanced manner. This is the ability to establish and maintain healthy relationships with our families, with our friends, with our co-workers, and also while we contribute to the social wellness of our environment. But also very critical is the ability that we should possess, where we must be able to place some distance between ourselves and those with whom we have unhealthy or hurtful relationships. Because sometimes we find that we tend to stay in relationships that are not healthy for us for some reasons or the other. But with mental health and wellness, it's very important that everything starts with me as an individual and then moves to the other people, because we cannot be of any benefit to anyone if we are not well. Then we will talk briefly about self-care. Self-care recognizes that your feelings are completely normal. Whatever we are feeling, whether we are not well, whether we are stressed, it's normal at that given time. We need to take time for us, for ourselves, and talk about our feelings with a trusted person. I think underline trusted, because sometimes we talk about our feelings and we talk to the wrong people, and then the situation complicates as well. Then we must ask for help. Very important. Reach out. If you feel that you are not coping, reach out and find somebody to assist. And be realistic about what we can and we cannot do, especially when we come to work and also family demands. Where you see that I really cannot cope with this one. People tend to know that if I go to so and so, she's going to assist, and they forget that you also run dry. You need to replenish your energies and your resources. So it's important to say, I can't do this. I can help you with this tomorrow, or I can help you the other day, because I've also have stuff to do that are quite critical. Because if we take on too much, then that's where we end up with stress that we cannot deal with. And then how the individual can promote mental well-being. Sorry, I think I've also touched on this. It's important to make social connection, especially face-to-face, as a priority. We will all recall when we were experiencing the shutdowns. I think that's where mental illnesses increased a lot, because all of a sudden we were cut off from everybody. We were cut off. We couldn't visit our families. We couldn't be in gatherings, and it was just lonely. And that's where we saw it's really those connections, social connections, are quite important. Stay active, exercise, go for a walk, talk to somebody, take up relaxation practices like yoga. Make leisure and contemplation a priority. We tend to work and forget about taking time and just do something that we enjoy. And it's important to eat brain healthy diet to support strong mental health, get plenty of sleep, perform random acts of kindness. Once we've given somebody something, you feel good about yourself. And I've really experienced that with community activities, that especially when you give to somebody that cannot give you anything back, you know that I've really touched, I've changed the life. Your use of stress balls or some other stress relievers, deep breathing exercises we mentioned earlier. Get yourself a pet such as a dog, and people always say if you want loyalty, get a dog, because dogs seems to be loyal. And also you maintain a routine that you can follow. Make sure that you have your routine that you can follow and maintain, and it just gives you stability and certainty. And also it's important at work that we take adequate breaks away from our workstations. Just walk around and come back, just to relieve the tension, even on our necks, on our shoulders, because we're sitting with laptops. Can I just drink water, please? Thank you. Lastly, we will look at, excuse me, sorry, robust solutions, especially in the workplace. Apologies. We need to understand our workforce through engagement, the surveys, such as absenteeism and retention data. What this helps is to design targeted mental health engagement surveys, because we've looked at our workforce, we know what's happening, then we design relevant interventions. We also look at what matters to our organizations, like for example, your mental well-being philosophy is important, where we articulate what it means for our employees and their families to strive. And number 3, what do you currently do? Gap analysis of the 3 Ps, our policies. What are our policies? What are the programs? And what are the processes? These policies, do they have a positive impact on mental health, like flexible working hours and stuff like that? These we can also adopt at home, where we're saying, okay, let's have an understanding what's going on here at home. We talk, because we find that most of the time we are at work. We're not talking at home. We get home, we eat, we sleep. What matters here at home? We speak to the families and say, this is our philosophy at home. We care for one another. We speak well to one another. We respect one another. And if there is a problem, this is how we handle the problem. We first discuss at home, and then we can go and discuss with Auntie so-and-so or Uncle so-and-so, excuse me. Apologies for that. This kind of brings stability at home, where we are like, we are a family here. We look after each other. We care for one another. If there is an issue, let's talk about it. Let's assist one another. And we agree that when we have challenges and we, for example, we send you for help, you also, we are going to play your part. You are going to comply with the treatment, or we are going to attend sessions, because sometimes we find that people do not attend sessions just because of the lack of support. But these we can adopt to any environment. And lastly, I've just shared the helplines, South African helplines. We have our South African Lifeline number there. We have the dedicated gender-based violence number. There is a suicide crisis number, and also there is an AIDS helpline number, which even has a WhatsApp number for people. This will be very nice to share with our families, or with people that are not necessarily on medical aids and stuff like that. And also, touching back to our statistics, the stats that I was sharing is about the workplace, the people that have means of reaching out for help or to therapists for help. We can just imagine what's going on out there in the communities for the people that do not have the necessary means to be seen by qualified therapists. In conclusion, colleagues, please remember that your mental health is a priority. Your inner peace is essential, and your self-care is a necessity. Thank you so much for having me. I appreciate this time and wish you all the best. Thank you.
Thank you, Sister Thabisile. That was such an informative and insightful message that you had for us today. I think what really stuck with me is, we have all these different views on certain mental health conditions, and we don't always realize that there's a different face towards it. I might see a colleague as being lazy, and actually they might be suffering from a mental health condition. So that just reminded me so much of that saying of always be kind, because you don't know what's going on in other people's lives. So, Sister Thabisile, there is a few questions, and then I already saw a hand up. I want to just relay one of the questions to you. Maybe you can respond. We have a question here, and he says, "Good day. I am an electrician. Can my employer offer me a lower grade job because I developed depression? Can they take away my driving abilities and my training, etc., because of this? They say because of depression, I am not suitable for my current job."
Thank you for the questions, colleagues. It's a difficult one to answer, but I'm going to be objective in this. The condition, depression, there are various stages that are associated with depression. The best thing to do with an employee who is suffering is to take them for therapeutic reviews by the psychologist, the psychiatrist, and even the occupational therapist, who is going then to conduct a functional capacity assessment. That will determine whether the individual is fit to continue with his work as it is, or he requires reasonable accommodation. So those are the steps that ideally should be taken. So I do not have the background, but I will safely say, before we change the job specs of an individual, we need to send them for assessment so that we have a view of how they are functioning, how their mental status is like, and how their capabilities are. And the best way to do that is to send them to the therapist that I have mentioned, and also to have an occupational medical practitioner then looking at all these reports and coming up with the recommendations to say, yes, they can continue with their job as they are, or we need to accommodate them while they go through their treatment. Thank you. I hope that helps.
Thank you, Sister Thabisile. There's another question here that says, I hit a very low depression in May this year. I spent 10 days in a clinic. Since then, I have seen my psychologist twice, 2 times. So for how long must I keep on seeing my psychologist?
Thank you for the question once again. It's very important that you continue seeing your psychologist until you reach a stage where he or she is comfortable that you are well. There are various mental status examinations or questions that we will engage with the client to make sure that we can gauge where they are in their mental status. Then it will then influence whether you still have to see them. If you are seeing them twice a month, then you might see them once a month or every quarter. But the decision to stop will be based on your recovery, and your psychologist is the best person to guide you with that one. I am aware that sometimes you'll find that the medical aids tend to run low and we cannot continue because we don't have a benefit anymore. But that is really a discussion that should happen between the client and the psychologist, where then you would look at other means to deal with your condition. But to simplify my answer, please stay with your psychologist until he or she is comfortable that you have recovered well, and they will guide you on the way forward.
Thank you, Sister Tabisile. Is it true that childhood trauma can cause depression in adulthood? And they also comment, lovely session.
Yes, thank you for the comment. I truly appreciate it. And to answer the question, yes, remember on the slides I did, under causes, we did have childhood trauma, especially if that incident was not dealt with appropriately, or we didn't expose it. You will find that most of the conditions will surface in adulthood based on what happens to us while we were small. So to answer, yes, it does happen. And if you feel that you are experiencing a challenge, a mental challenge because of your childhood traumas, please reach out. The clinicians will be able to assist you to deal with those challenges. Thank you.
Thank you. Here's a very interesting question, and I think it's very important because it kind of speaks to a lot of what you said today. But they ask, what do we do next after one of a family member has done everything in their power to assist someone with mental health, being there for that person, going to a therapist, but they still have suicidal thoughts up to the point of even trying it?
Yes, that is a difficult one. I think I did touch on suicide. And sometimes we do everything that we can. But remember, again, it's about the person. There should be a will from me to recover. But suicide is very difficult because it means that that person has reached a state where they feel that they cannot do anything about it. So that is where it's very critical that you will engage the therapist that is involved with that particular person, because then they will deal with it, even if it means that the person gets admitted in hospital so that they have continuous therapeutic interventions while they are in the hospital, because there is a limit to everything that we can do to support as families, as friends, as colleagues. The therapist will be able to work with the inner person in me to recover, to gain that strength, that inner strength to deal with issues, because it needs to come from inside them to get this empowerment, to get this thing inside them, to say the spirit man to stand up and say, yes, I can do it. Yes, I can do it. So we can't do everything for our families. If we have tried everything, that means we now need to really get in touch with the specialist and make sure that we support the family member in attending, because it's very crucial that they attend the sessions. And also, if it means that they get admitted in hospital, they need to be in hospital and be supported there. But there is a limit in what we can do as individuals. Even with us in the health sector, we try our best with our families, but we know somewhere we can't get through. They need somebody else. So I would say, please work with the therapist, work with the psychologist or a psychiatrist, and just encourage them to be admitted so that they can have continuous therapy sessions that they will undertake. I hope that helps, but I do acknowledge it's a difficult situation.
Thank you, Sister Tabisile. I'm also hearing that, it's sometimes for the support person, the family that supports someone with mental health, it can also be, draining and frustrating and challenging. So self-care for ourselves is also very important. Even if we don't have a mental condition, we still have to take care of ourselves and to be able to take care of others and support them. I have a
Definitely
question here
support.
that's,
Okay,
yeah.
sorry. Yeah, thank you.
There's a very important question here, but is mental problems always caused by issues experienced in life?
Most of the times, yes, it will be issues that we have experienced in life that bring about that effect. But also, with depression, we know that there are physiological effects where there is imbalance in the physiological functioning of the individual. So that's why when you go to the doctors, they will also do your physical test, like your bloods, to see if everything is balanced, if the nutrients are balanced, if the hormones are balanced, if there is anything that is not right. Then with medication it can be corrected, but mostly it's triggered by something that has happened to us, and then you end up with that problem. But some, like for example, you might be very well and healthy, and then you lose somebody that is very significant to you. Immediately you slump into a depression, or you feel that there is no reason for me to live. I'd rather also just commit suicide and go and be wherever they are, So the stresses of life, or what we go through, really influence our mental status. But also, if there are any chemical imbalances in our physiological status, then that also will bring about certain mental illnesses like depression.
Yes, definitely. There's a question that leads up to that, and it says, is social media affecting teens self-diagnosing things like imposter syndrome and all those type of things? So does our social media, does it actually have an effect on our mental health?
My answer would be yes, and somebody might have a different view to it, but you find that especially with the young ones, with the teenagers, there's this imposter where somebody will post a lot of things on the social media, and showing that they are well off, they've been out, they drinking this, they eating this, and then it puts pressure on the friends to be like them, even if you know that there are no means to do that at home. So already you are sitting on the negative, because you're wanting to be somebody that you are not, and you're wanting your parents to provide for something that they cannot provide for, or also you don't even know that other person is not being genuine with what they are posting on social media. So social media has a lot of influence in our mental status, where somebody is put under pressure to be whatever they are not, and also wanting to be the celebrities, the hair, the weaves, the whatever. There is a lot that is going on. The life, the fleshy life that people live, and we all want to be that. We just have to take a step back and understand where we are, where we want to go. Is what does it mean? Sorry, what does it mean to have flashy cars and be stressed? Those kind of things, to measure our goals as to where do I want to be, where am I going as a Tapsil, where do I want my family to be in the next year or two. So yes, social media does cause a lot of stress, especially with the teenagers, because they are not as matured as us, where you can be able to say, hey, as long as I can drive to work with a car that is relatively okay, will not break down, I am fine. I don't need to drive a particular car and live a status that I cannot afford. So yes, it does cause a lot of stress with especially with the teenagers.
Thank you, Sister Tapisile. Everyone, our time is nearing to an end, and I know there's so many other questions that you might have. I want to remind you, at Tempo, we also have what we call an emotional journey that's online, available on your app. If you just log into your Bestmed app and you go to Emotional Well on the Tempo platform, you will have a lot of information. We also host discussion groups once a month where you are welcome to join. Our following one is next week. So look out for the invitations. Please join us and ask us more questions. We will be there to support you the best we can. If we didn't get to your answer to your question today and you still need an answer, please send us an email at tempo@bestmed.co.za and we will refer your questions maybe to Sister Tabisile to answer, or we will find you the correct answer as soon as possible. Thank you, everyone. Sister Tabisile, thank you so much for today. Thank you for your advice, for your information, and just your heart for mental health. Thank you so much.
Thank you, colleagues.
Thank you, Tabisile. All the best.
Thank you.
Have a great day.
Thanks, Tabisile, and everybody. Bye.
Thank you, colleagues.
Yeah.
Bye.
Thank you.
Thank you. Bye.
Bye.
Thank you. Bye.
Bye. You Bestmed and Tabisile.